They recommend screening for 21 to 65-year-olds, either with a PAP every 3 years or starting at age 30, the PAP HPV co-test or the primary HPV test every 5 years. So if people have previously had precancers that have been treated with a procedure called LEAP, they should not stop screening. If they're immunocompromised or have had cervical cancer, they should not stop screening. Or if they've had in utero DES exposure, they should not stop screening. So we need to have none of those risk factors and then 10 years of either 3 negative PAPs or 2 negative HPV tests to say, yep, you're done. So we now understand that persistent high-risk human papillomavirus infection, or HPV, is the cause of the majority of cervical cancers. So basically, anyone with a cervix who is sexually active is at risk, particularly if they haven't had the HPV vaccine series. The CDC says about 80% of sexually active adults will have an infection at some point in their lives, but many folks won't recognize it because it generally clears on its own. And so they may not have ever had an abnormal HPV test as part of their cervical cancer screening. HPV 16 and HPV 18 are the highest of the high risk. They cause 70% of cervical cancers. So if either of those are found on the test, what the patient will need is a referral to colposcopy, which again is that outpatient procedure where the cervix is looked at under a microscope and some little pinch biopsies might be taken of the cervical tissue just to ensure that there's not precancer.